First, when I got into this area of plant-based nutrition, both myself and mentioning to patients, I'd known about Dr. Esselstyn's work at the Cleveland Clinic, where he took patients with advanced coronary disease, designed a dietary program to mimic other countries in the world where the rates of coronary disease was exceptionally low or even unheard of. And that was a dietary program with no added oil. So it's not an oil-free diet, meaning that you'll have fats and oils in the plant-based foods. You just don't add oils that have been extracted from an animal or a vegetable and pour it back on the food. And I must say, as I've spoken to Dr. Esselstyn in person about this on a number of occasions, and I consider him honored to be a good friend of mine, I thought that the restriction of oils was a bit extreme, and that do we really need to do that? If we get people to plant-based eating, won't they get benefit? And I think if they switch to a predominant meat-based diet to a predominant plant-based diet, you will get benefit. But I must say, I've realized the wisdom and importance of restricting added oils in people who are very sick and have active coronary disease. So folks who struggle with exertional chest pain every day, or what we call angina, if you restrict their oils and focus on dietary approaches that limit the amount of added oils, they'll get very quick, within days, improvements in their anginal control. Teaching me and telling me that, again, the wisdom of Esselstyn to restrict the oil really has important clinical implications and that are very fast and noticeable to the patient. Same way with people who have cholesterol levels that just won't seem to come within range, or blood sugar problems that seem to have improved on a plant-based diet, but they're still have sort of hanging sugar numbers that they're nagging and won't come within range. Those are the people, if you start getting 3-day food diaries and drilling down into exactly what they're eating, those are the people who are eating, like, for example, an excess amount of peanut butter, or they're taking in some oils. And isn't olive oil healthy, they say? So I add some olive oil to dressings. When I negotiate with them and say, look, just for a month or 6 weeks, get rid of all the added oils and the high-fat foods, even if it's plant-based foods, such as avocados or peanut butter. They come off those foods, we redo their blood work, and very consistently the numbers fall into line where they should be. So added oils seem to be a significant aggravator of both the markers for vascular disease, like cholesterol levels and blood sugars, and also in the actual size of the restriction of blood flow in the coronary artery. Within weeks to a couple of months, we've seen significant improvements in anginal symptoms when oils are really taken seriously and restricted as much as the patient can manage.